Greetings. Mark Orang here, publisher of the Conway Daily Sun, and my guest today is Karishma Manzur. And hey, how are you doing?
Good.
Nice to meet you.
Thank you, Mark.
And you are running for the U.S. Senate on the Democratic side.
Correct.
So why don't we start with who you are.
Yes.
Maybe introduce yourself, tell us a little about yourself. We're actually going to have a photo after you speak for a second. We have a photo of your family. That's always fun to see.
Okay. So my name is Karishma Manzur. I live in Exeter, New Hampshire, and you'll see in the photo, there's my husband and my 2 children. My daughter is 19, she's off to college, and my son is 16, and he's a high school student.
And how long have you been in Exeter?
Over 5 years now.
All righty. And where were you before that?
But Massachusetts.
Ah, well, you don't want to say that too loudly.
Exactly.
I know. You have to be careful. Okay,
Yeah.
but you are a, do you have the photo, Rob? Can we just see, since we're talking about the family? Oh, there they are. And that's your daughter, who looks pretty much exactly like you do.
just an inch taller. And so that's Aliana, and then Elias is my son, and my husband's Alex.
Nice. And so your son's in high school?
He's a high school student. He just started his junior year in high school.
Cool. And your husband, what does he do?
He's also a scientist.
You're both, okay, so you're both
scientists. Yes, we met in the lab. That's the only place scientists meet. Yeah, exactly. So we met in a lab. I was doing my PhD, he was doing his postdoc, and that's when we met.
And what do you, so what's your science, what do you specialize in?
So my PhD was in biochemistry and molecular biology. And so after doing my postdoc at UC Berkeley, I decided to move into clinical research instead of staying in basic research. So basic research means anything that is not human, non-clinical. And clinical research means when you're working with humans. So I've been working in clinical research for over 20 years now.
And where do you work?
So originally I was working at biotech companies on various molecules, and then I moved into and started my own small business, and I was working with biotech companies but just partnering with them.
Now, how's that? I mean, since we're talking about that,
yes,
and the funding,
yes,
and all the funding, and also with RFK, Junior was on. He's been grilled yesterday.
Oh God, yes.
Obviously, being a scientist, you think the vaccines, you believe in the vaccines, obviously.
So if you understood how much integrity there is in the clinical research process, you would find what Secretary Kennedy is doing abhorrent. We are people we're highly educated, we believe in the data, we proceed very carefully. The Food and Drug Administration and other regulatory bodies across the world it's a highly regulated process. How much data you need to show with safety and efficacy before you can go into humans. And we start off very small. So we start with phase 1 studies, which is very small studies. We usually start with healthy humans, a lot of times men, because then we're not worried about pregnancies. And if we find that it is safe, then we move into maybe a patient population, unless the drug is something along the lines of a cancer drug, which is extremely toxic. Then we might move, the phase 1 might already be in patient population. But at each stage, we are checking the physicians who are involved, the statisticians, the clinical researchers, the basic scientists. It's a huge team effort. Nurses, you name it. And we are checking the data constantly. Is it safe? Is it still
But nothing
efficacious?
is absolutely safe, right?
Nothing, well.
I mean,
right.
Any of the
right.
drugs that you hear on TV,
yes.
Blah, 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 watch out for this, that, and everything else.
I mean, it was a 2-hour drive from Exeter to Conway.
Right.
It was not things could have happened, but then you look at the risk versus benefit. The benefit is I made it here. The risk I took was maybe there would have been a car accident, but thank God there wasn't. But in clinical research, we're constantly looking at, maybe a side effect might be headache. A side effect might be a GI trouble. But is it tolerable? Can we control it with available medicine? Can we sometimes, as we're proceeding with and finding out the data that, okay, there's causing some other symptoms, we say, okay, if we lower the dose, can we still be efficacious? Efficacious means, is it still working?
Right. So how do you? I'm going to cut that. I'm going to cut that off because we're going to get in the weeds.
We're going to get into the weeds.
Right.
Okay, don't.
So how do you account for people not really believing in the vaccines or being skeptical about those? I mean, the example I use is like in the late 1700s, the milk-borne diseases killed more babies in New York City than anything else, and they came up with pasteurization. And it took decades before people accepted that. Like,
what can I do? I mean, it's almost impossible. A lie is a lie. I mean, these are all fabricated stories that Secretary Kennedy has been actually, he's been talking about these for years. It's not new. That's why a lot of the folks in Congress were concerned about his nomination. They did not want to give somebody who has no medical background, no medical training. Just so you know, he's an attorney. There's nothing in his background that in medical research or clinical research or anything. And yet now he is in charge of such a huge number of people in our lives.
one more question about science, okay? And that is the, like with the research money, like if you work for a biotech firm, is that private money? Was that private money or was that research money from the government? Or do they intermix?
So when I got my PhD, that was funded by the NIH. I'm sorry, I touched my mic.
Yeah.
It was funded by the NIH. When I did my postdoc, it was also funded by the NIH because the NIH wants to encourage people to go into research because it's a 6-year program. Postdoc can be 3 years, 4 years, and you have to feed yourself. So the NIH encourages people to go into science and get a PhD and a postdoc. So I was funded by the NIH. The biotech companies that I worked with, some of these were, most of them were privately funded. So they were affiliated with, like, say, Johnson & Johnson or other larger organizations.
So how much of a threat, if I can use that word, with the Trump administration, you know, pressuring the colleges, and we know a lot of research is done. Like, how do you see that? Like, I have a, you know, I have my neighbor's a doc, and he works in one of the hospitals in Boston. He was saying he knows people that are out of work, and it's going to show up in lack of research in the next few years.
Of course. I mean, he has canceled thousands of research studies. And in the process, when he said, when this administration, I should say the administration, blocked some of these, the funding, the postdocs, the students, the lab techs, some of them just had to leave because there was no money. Was it going to be a 6-month hiatus? Was it going to be a year from now? They don't know. So the research just came to a standstill. And so these folks have now either become unemployed or they've moved into another industry. We are in this unacceptable attack on science is basically, we should all be concerned about it. We should all be concerned about it because medical research leads to so much information coming out about the human body. And the human body is extremely complex. This is why when we do research, we have to be very careful because every person, depending on their age, their gender, whether they're pregnant or not, whether they're elderly, whether they have other comorbidities, the way treatment will impact them is going to vary. That's why we move very slowly. We look at the special populations. And in order to even reach that level of understanding, the basic research that's coming out of the universities is extremely important because they are looking at all the different proteins that are involved, all the different genes that are involved, all the different carbohydrates that are involved. And that information helps lead us to understand better what the clinical trials, how effective it will be. In general, why is our system, I mean our U.S. system, it seems like my layman's understanding is that a lot of the research money really goes through universities. Is that similar to Europe and Asia? So research at the university level is a certain level of research, and also sometimes they are doing clinical research with the public funding, but there's also a lot of interest in the private sector for clinical research because then it will be marketed.
So the big farmers.
Big pharma, small pharma, biotech companies, et cetera. It doesn't matter. Like whether you look at aspirin or you look at any other medication that's out there, I mean, it came from, some of the information came from from the universities, and it was also then some of the information came from the private industry.
This is totally random.
Random question, okay, go for it.
No, there's not, well, there's science. We got to get to the politics. Cause
we have to go to the politics, sorry.
But I read years ago that if you take an aspirin a day, and I realize there are issues with aspirin and all that, but it really prevents, there was a big study done in Europe, and it prevents like all these types of cancers by 30%, 50%. Do you believe that?
So, okay, so I just want to make sure
'cause I
everyone
want people to
understands.
know.
I have a PhD, not an MD. I'm not a medical doctor, so I cannot.
Yeah, they're all, those letters are all the same. Just mix
No,
them up.
no, there's a big difference between a PhD and an MD. A medical doctor focuses specifically on the
Right.
human body.
Right.
So I do not want to give out any information. This is exactly what we're talking about with RFK Jr.,
right.
that he is not qualified to talk about
So
the
you're not
medical
going to
body.
talk about aspirin.
I'm not going to talk about
All right,
aspirin.
Okay, let's move on then. Speaking of health, so one of your issues, reading your website,
Yes.
is Medicare for all.
Yes.
So I'm an old guy, so I'm on
Yes.
Medicare. It works pretty well for me.
Yes. Talk about it.
Talk about it.
So at the moment, if you look at the spending, the healthcare spending in the United States, it's $5 trillion. $5 trillion, and that could be coming out of the employer funds, the taxes, the copays, the deductibles, everything. All of it, think of it as a box. It's a $5 trillion box. From that, people are receiving certain medical services, but millions are not receiving, have no insurance in America. Millions of people.
A lot of millions got on insurance with Obamacare.
Yes. About 20 million additional people received
Right.
healthcare through Obamacare. So that was not a perfect legislation, but it was very good at bringing people into the healthcare field, into to receiving a health insurance. So we have Medicare, we have Medicaid, we have private insurance, which is all fine, except that it's very expensive, $5 trillion, and it's not covering millions of people. Is it of concern? Absolutely. Those people, when they are having, a GI bleed, or they're facing cancer, or they're heart disease, or a car accident, they are going into debt, or they're just dying.
Or the hospitals are paying for the service. I mean, we know that too, right? People uninsured, everybody pays for that.
Okay, I'll touch on that in just a second, but let me finish my first thought, which
Okay,
is that.
sorry.
Okay, so sorry. No, Mark, you can.
We're going to have a lot of subjects here, so I'm moving along.
We have to move along. Okay, here, time. Oh, okay, I don't have a watch on. Someone came. Okay, but I just want to say, it's a $5 trillion system, and yet it's not adequate for the fact that so many people are not getting covered. Because, and you might say, why is it? Almost 34% of that money, which is almost about $1.7 trillion, is going to profits and to bureaucracy. Think about that.
Okay, but of course the obvious answer, the obvious question of that is, well, you're going to have a government bureaucracy taking its place.
No, but wait. So 34%. That is $1.7 trillion that is being spent in the United States is not going to the doctor's offices, it's not going for the MRI scan, it's not going to the nurses, it's just going to Wall Street. It's going to bureaucracy. So if you walk into a doctor's office and you just check into your primary care, there's a receptionist who checks you in, and look behind that person, you'll see 2 or 3 people working in the background. Those are not nurses. They are just there to haggle with the insurance companies. So even if it's a primary care physician who has gone through medical school, who has gone through internship and residency, has cared for patients for years and is an expert of this subject, they ask for a blood test or they ask for a certain diagnostic test, their office now has to fight with the insurance company. And every single insurance company has a different system. Some have a better system on the computer, some don't. Sometimes these billing people in the offices are on the phone 1 or 2 hours about one patient and maybe one test. Think about the inefficiency in that system, and think also how that medical doctor feels. I mean, they're now asking someone whoever, they don't even know where that person is. They have to justify to this person who may not even have a medical degree why their patient that they have physically seen in person needs a certain care. So, that, of course, that's...
But isn't the private, I'm interrupting you here, I know.
You are, no, go for it,
Isn't the
Mark.
private sector paying for that wasted money? In other words, you're saying it's a $5 trillion system, 1.7 is wasted, but it's not the government
Oh, well,
who's wasting
wasted
it.
is...
I mean, not wasted, but bureaucracy and all that.
Profit, I mean...
So that's the point, is how much is it going to cost us,
Yes.
the government?
No, if you take away the $5 trillion current system and you replace it with Medicare for All, which will be a universal health plan and cover every person, all Americans, right? And it will be, I know that the name also is it kind of builds off of Medicare. but it's different from the current Medicare system. So like the traditional Medicare. So in that, Medicare for All also covers dental, hearing, vision, which the traditional Medicare does not, as well as long-term care. So Medicare for All is like an enhanced Medicare.
Okay.
Okay, so wait. So.
But I want to say one more thing.
Yeah.
Okay, but the Medicare, even if it is Medicare for All, it doesn't
Yes.
mean the government is getting in. The government is not getting into the health business.
Correct. It
right?
is not. It's
sort of
going
like
to be a
the-
single payer system. Correct.
Right.
So if you look at it like you go see a doctor, the doctor, I mean, there's that relationship, and then normally you visit a doctor, you have Medicare for All, the doctor then, it's going to be whatever, a $100 visit or a $150 visit. They just send the bill to the Medicare for All system, and then they get it back, and that's it. There's just 3 points: the patient,
Right.
the provider, and the single payer
So the
system.
government in your system and Medicare for All, it's not that the government is getting into the healthcare business.
No.
It's just they're the middle person.
There's just one, right, exactly.
payer.
It's like a one system. And then you're getting rid of all these bureaucracy, all those billing department people, all the, also,
PBMs.
yes, as well as, those are really, yeah, that's another
Those are
topic,
awful,
which is awful.
yeah.
And then, and also there's going to be then a cap on prescription drug prices, and it's going to be across the board. It won't differ depending on, do you have insurance A or do you have insurance B, et cetera. So, but where was I going?
Oh, okay. Can we move
Oh,
on? Okay, go
well,
ahead.
no. I want to,
Hey, it's your show. You can speak as long as you want.
so hold on. Wait, I want to say one thing.
Okay.
Let's think about 2 services that we don't even, we will never allow them to become for-profit institutions. One is the fire department, and one
Right.
is the police department. Our fire departments of every town and every city is funded through taxes and government subsidies, et cetera. We hopefully do not need to ever call the fire department or the police department. But when the day I need it, I'm really happy that there's a fire department. If there's a fire in my house or there's whatever, gas leak, and if a burglar breaks in, I'm really happy that there's a police department that I can call. Those are not for profit. Nobody says, how much is the police department making? You know, maybe we should look into this. We just know that this is a service, it's provided, it's necessary, it's essential. Healthcare should be exactly like that. It should not be for profit. Nobody should be making money out of taking care of other people. You should just be providing the salaries of the physicians and the nurses and maybe certain technicians, the building costs, et cetera. But you should not allow CEOs to make money off of the fact that people are going to get sick. I want to tell you a story.
Okay.
I know you have a long list, but I have to tell you a story. A friend of mine, her loved one, had private health insurance, and her physician prescribed a certain treatment, but her insurance company said they are not going to cover the treatment, and this person died. That same year, the CEO of that insurance company made $19 million. That's called medical murder. We actually have a term, Mark, in the United States, medical murder. Think about that. It basically means if these people are just constantly calculating, you know, if you're young, you're healthy, they want you. If you're old and sick, they don't want you. And they're basically holding off care because it's less money in the CEO's pocket.
Okay. So we got to move on. But one more general question about.
But then one day we will just talk about healthcare. How's that?
But but we know that, I mean, Medicare really is, you know, for everybody who's over whatever 65. But in other countries like England has nationalized health insurance.
Correct.
And Brazil, because I know my son is married to a woman from Brazil, they have national, but everybody has another tier of private insurance too, health insurance.
Okay. I'm not an expert on England or Brazil.
Okay, then never mind that. Let's move on. Okay, another one of you're in favor of ranked choice voting.
Yes.
And why? Okay, so that's one, we got to explain it.
Yes.
So ranked choice voting is that when you vote for 1, 2, 3, and if the person at the top doesn't get 50%, a majority, then if you voted for number 2, that number 2 button goes to another
there's
one.
a little simple,
Right.
Yes, exactly. And why do I like it?
Because it's like voting, I always think it's like you get to vote twice, and that's not right.
No, you're just basically saying, in this binary choice that we have, it's really not very democratic. Because you're just saying option A or option B, and you're like, you know, are these my only choices? So in a ranked choice voting system, you'll have more than just a binary choice. You'll have, if it's a depending on what gets passed in every state and every city, it'll be different. Whether it's going to be like you'll have up to 3 options, or you'll have up to 5 choices, or 7, whatever they wanted. Think about this. So you're saying, I like candidate A the best, so I'm going to make that person my first choice. I kind of like candidate B. I definitely don't like candidate C, so I'm going to leave candidate C out. And that kind of shows the preference, because when it's a binary choice, it's holding back the voters' plans. It's not very democratic. So this is one thing. The other thing that is very good about the ranked choice voting system is you are not then just trying to get a divisive vote. You actually have to get more than 50%, and you actually have to reach out. So a lot of the systems, like in Alaska and Maine has just started. What happens is every candidate then starts to become a little bit more normal.
Central.
Yes.
No, I get
exactly.
I get that.
It takes away all that divisiveness. It takes away those attacks. They become kinder and nicer, because now they actually have to work across all the ideologies. So that's why I like ranked choice voting. We only have a 2-party system. I wish there were more parties in the United States, because that would give people a lot more choices. There are a lot of people that don't conform either to the Republican Party or to the Democratic Party, and then they feel disenfranchised. They are not affiliated with either party. Okay, at least they can be independent, but then when they go to vote, they again are left with those 2 choices. So ranked choice voting is just to encourage people to have more options.
Yeah, it's an interesting, I know Maine started a few years ago, and of course we know that in our primaries is usually the extreme candidates on both sides.
Yes.
Because they're appealing to their base. So.
On both sides,
Good
yes.
point. All right, what else? Big money in politics.
Oh, yes.
So you don't like that because you probably don't have any big money.
Exactly. So let's see. Let me give you an idea. When I spoke to someone a few months ago that I was getting ready to launch, of course, it takes a long time. It's a grassroots effort. It's not like consultants are feeding me policy positions or fixing up my website. Everything is just several volunteers, and we're getting together and we're working on this. So this person told me, Karishma, are you a millionaire? And I said, no. They said, do you have a billionaire donor? And I said, no. And she said, then why are you even thinking of running in the U.S. Senate? So think about that, Mark. You have just basically said, if that's the idea, that 99.9% of New Hampshire's population can never consider a federal office position. Is that democratic?
Well, you can consider it. I mean, certainly anybody can run.
Many people will not even think about it nowadays, because that is the problem. You have to be, there's millions of dollars flowing through the system. You actually have to cater to the donors and the corporate interests and the special interest groups and the corporations. It's terrible. It should be a public service position. The job of a representative or a senator is to serve the public, and as well as the president and the cabinet secretaries, everyone out there in Washington. These are public service positions. You serve the public, not the donors, not others. And yet it doesn't feel like a public service position anymore. It feels like a financial service position.
How does the funding work? I mean, we know Citizens United and people are really against that Supreme Court decision because corporate money and all that.
Yes.
But how does it fund? How are campaigns funded then? Government?
So there is public funding, but at the moment, public funding has just about dried up. There's not really any.
What's the answer?
So I'm asking for donations.
No, you're asking for donations, but if we don't have this system, how do you get big money? Like, if we don't have big money in politics, how do people run?
Oh, through just grassroots donations. You know, it should not.
So the real issue is the citizens, the Supreme Court decision, right? Because everybody can.
Partially. Well, even before the Citizens United case was approved by the Supreme Court, we already had big money in politics coming in from other sectors. So do you remember the name Granny D. Haddock?
Yeah, I think I do. You mean the older woman?
Yeah, exactly. Yeah. She was from Laconia.
Yeah, right.
At age 89, she walked all the way from California to Washington, D.C., basically talking about the big money in politics and how that was the greatest threat to our democracy. Her organization is Open Democracy. I'm on the board of Open Democracy.
Oh.
Yeah. So you can see, people are like, are you going to take a corporate PAC money? No, I'm on the board of Open Democracy. This is exactly what we're talking against. Because it is, again, like Granny D told us years ago, it is the greatest threat to our democracy. And you see this. You see this. I have one vote, you have one vote. But a billionaire can buy many votes for their preferred candidate. They can have little lotteries or whatever was going on in Pennsylvania during the presidential election by somebody we all know, billionaire Elon Musk. I mean, what was that about?
Yeah, PACs and all that, for sure.
And PACs and all that. So exactly. So we have to say, at the moment in this year, each voter can contribute up to $3,500 per candidate per election. And that's more than enough, okay? $3,500. But a corporation can, or a billionaire through the PAC system can contribute millions of dollars. So think about, a whole town might prefer candidate A, but a billionaire comes in and says, I prefer candidate B. Well, candidate B is going to have TV ads and pamphlets and paid workers running around. It will not be a true grassroots, it will not be a true democratic process. So billionaire will, and their candidate of choice will end up actually winning the election. Well, because they'll have a bigger voice, they'll have a bigger reach. It is not democratic.
All right. Okay. Why? I mean, you don't have any political experience. I mean, you've been volunteer, but you don't have any experience in elected officials.
I do not, but I have 2 positions within the New Hampshire Democratic Party. But again, I'm not going to necessarily talk about it because I'm on the Rules Committee of the New Hampshire Democratic Party.
Okay.
And I'm also on the Rockingham County
So
Executive
why?
Committee.
I mean, U.S. Senate. That's like, trying to hit the home run on the first swing at the bat.
So as a scientist working in clinical research, I loved my job. I could have a 12-hour job, 14-hour day. I'm sorry, 12-hour day, 14-hour day. I just loved it because at the end of the day, regardless of whether it was a mundane data analysis day, or it was really interesting because I was looking at interpreting the data, I just loved it because at the end of the day, you always felt you were helping people. But then about 2-3 years ago, I started to look at some of the numbers out in the field, and I was just disheartened, which was 50,000 Americans die each year from lack of health insurance or underinsurance. Mark, 50,000 people. That's unacceptable, right? And so then I started to question, well, why is that? We're the wealthiest nation in the planet, in the history of the planet, and yet we have 50,000 people dying in this country. So as I started to look into it, of course, I realized the inadequacy of our healthcare system. But then you say, well, that's a no-brainer. Why doesn't Medicare for All pass? Because it's not a new idea. Senator Sanders has introduced it in the Senate several legislation sessions in a row, and Representative Jayapal has introduced it in the House several sessions in a row. But it doesn't even get full Democratic vote. And of course, we should not let the Republicans get a pass here. They should care just as much about saving American lives. So if a Republican or a Democrat or an independent has not supported Medicare for All, they should not go back to Congress. They should be.
Okay.
But wait.
Okay, go ahead.
Wait, what was the question? Okay, why did I get into it?
Yeah, why did you get in?
I want to save lives.
And we only have 2 minutes to go.
Oh, I want to save lives.
Okay, you want to save lives. But the other question, this is, I mean, people in Washington are saying, wait a minute, are we voting this fall? No, it's next year.
Next year,
so
exactly.
You'll be back, and
September
we can have you on
2026.
again. So this is an intro, but
yes.
Pappas. I mean, you're going to be up against, you're in the primary against Pappas. He's well-known, 4-time congressman. He's pretty liberal. Is he not liberal enough?
I'm not sure how you define liberal, but...
well, I don't know. He votes Democratic.
The record shows that Representative Pappas is one of the most...
bipartisan.
Bipartisan and...
Is that bad?
No, not under normal circumstances, not. But if you like Donald Trump's policies or the Republican policies, which are very undemocratic and not very good for our society, then maybe not. Then go ahead, reach across the aisle. But when it's not exactly helping Americans or causing horrific trouble across the world, then I would say let's not reach across the aisle, because let's stand on our own 2 feet. So again, I'm running my own campaign. This is not an opposition campaign, but if you wanted to ask me some policy differences, because he's a nice man, I'm a nice person, so let's talk about policy differences. Medicare for All is one of our biggest differences. Representative Pappas has not sponsored, co-sponsored Medicare for All in his first three terms, and this is his fourth term, and I think he has also not co-sponsored it this time around. And I think that's a huge difference. The other difference, of course, there are quite a few, but I'll just touch on two, which is Medicare for All and also the war in Gaza.
Okay, now, but he didn't support, if I get this right, he didn't support with most Democrats about supplying Israel with more weapons, or some level of weapons. Is that true?
Ask the question one more time. What is
I think, where are you going with, okay, let me ask it this way then. Instead of saying what I think about him, what he did, how do you differ with him on the Gaza?
I would not send weapons. So we actually have federal laws in place that basically say that U.S. weapons cannot be transferred to any foreign entity.
Right. He did, I'm sorry, I'm going to correct myself. He did vote for it, which was against, I think Jeanne Shaheen voted against it. But anyway.
So, yes. So
I know.
Okay.
I haven't thought about this in a while.
Sometimes it's is it yes good or no good? Exactly.
Yeah.
So there was, in the House and the Senate, there were resolutions basically saying, it was a joint resolutions of disapproval to stop weapons transfers to Israel.
Right.
And Jeanne Shaheen voted along with Senator Sanders and others to basically say, yes, human rights are being violated, therefore we should not send any more U.S. weapons to Israel. And there was a similar resolution in the House, and Pappas voted against it.
Yes. That's right.
So he voted the opposite of the way Senator Shaheen voted, yes.
All right. Why don't we leave it at that, because we're out of time.
Oh.
But you'll be back.
We had so much fun. Wow.
I know. Okay. Karishma, it was very nice to meet you.
Thank you so much. Thank you.
And good luck, and we'll see you when you come back.
Thank you so much.
Okay.
Take care.